Good afternoon. Today we are starting with our last and final day, that is day 5 of the 5-day free course. So today we are going to discuss some examination scenarios, and let's go ahead and read the question. Okay. The question reads the following. Okay. You are FY2. Mrs. Smith is a 75-year-old who has been brought to the ER by the police. She was found sleeping on the bench and she appears to be confused. She has no serious offense or police records against her. Assess Mrs. Smith for confusion, and at the 6-minute bell, please discuss management with the examiner. Okay. Now, so what do you understand from the question? First, that you are a foundation year level 2 doctor in the emergency department. Second component, that there is a patient whose name is Mrs. Smith and she's 75 years old. And what do you know about her? That she was just found in the morning on the bench because she was sleeping and she's confused, and she has no serious offense or police records against her. Okay. Assess Mrs. Smith for confusion, and at the 6-minute bell, discuss management with the examiner. Okay. So here the most important thing here is to assess Mrs. Smith for confusion and discussing management. Does that mean you can skip history and straight away start off with assessing for confusion? Yes. Question? No. So you are going to take a history. So what will be some of the points that you would ask in the history? As soon as you enter, you see a lady who is very anxious and very scared. Okay. So let me give you a little bit of background information. So there is a lady who's anxious, scared, and she's very distracted. So she may be sitting, she may be standing, she may be walking across the room, or she may be on a couch. So anything, you can expect anything. Most probably, if it's an ER, patient will be on a couch. Okay. They may be walking about or pacing about, right? So especially patients who are confused, they may be distracted, maybe pacing about, but please do expect a couch. Whenever the scenario says ER, expect a couch inside. This patient is inside, very distracted patient, and you know, when you introduce yourself and you say, yeah, my name is Nafia Shafi, and you know, I'm the junior doctor here in the emergency department, please don't ask, how can I help you today? Okay. Do not ask, how can I help you today? And now you want to confirm this patient's identity. How would you do that? So what you can do is just say that, yes, my name is Nafia Shafi, I'm the junior doctor in this emergency department. Am I speaking to Mrs. Smith? Okay. So ask her itself directly. Give a direct question, a closed question. Am I speaking to Mrs. Smith? So she will say, yeah, that's me. Yes, that's me. I'm Mrs. Smith. Okay. So Mrs. Smith, are you 75 years old? So she will say, yes, I'm 75 years old. Okay. Here, asking a closed-ended question would be very beneficial for you. Okay, because anyway you are confirming the identity, right? If you go and you give this patient an opportunity to talk about themselves or to confirm the identity, then they would give you some reaction and probably take away your precious time. So my advice is, go inside, introduce yourself. Am I speaking to Mrs. Smith? Okay. Now if she looks here and there and she appears confused and she doesn't respond, then just call her by the name Mrs. Smith. Distracted. So at that point, it means acknowledge my non-verbal cue. That's what the simulator is trying to tell you. So please tell her, Mrs. Smith, you look really confused. Is everything all right? You look really distracted. Is everything all right? So at that point, she will say, I don't know what I'm doing here, doctor. Where am I? Why am I here? Right. So your task has started. Now, the first time when you asked the patient to confirm their identity, they didn't respond. They appeared distracted. So you tried to confirm the identity the second time. They did not respond. Okay. The third time, what you will do is acknowledge the non-verbal cue and then confirm the identity. If you get an answer saying, I don't know what I'm doing here, it means she acknowledges her name is Mrs. Smith. Okay. Safe to move on. About the age. How, if she's telling you, doctor, I don't know what I'm doing here. I don't know why I'm here in this place. I don't know where am I. So please don't jump to your next question, that is confirming the age. Okay. I know you would be really tempted to do that because you want to get over with confirming the identity. But please remember, this is a case where you're dealing with a confused patient, a distracted patient, and your first and foremost job is to make them comfortable. So you will explain to them, you are here in the emergency department of the hospital. I'm the junior doctor here. My name is, please say your first name and your last name together. Are you following me? Ask her. Okay, so she'll say, yes, but where is my daughter, doctor? If she says, yes, but where is my daughter, doctor? Then ask her details about her daughter. So can you tell us something about yourself? First ask her about herself. Can you tell us something about yourself? So she'll say, like what, doctor? What do you want to know? Your age. Could you tell me your age? So then she will say, I'm 75 years old. So please know how to negotiate with a patient who is confused when you're located in the ER for the exam. Okay, now this can hold good for practice after the exam also, but always please remember that whenever you have a confused patient, whether it is the GP clinic, whether it is the emergency department, whether you are just taking a walk outside, you see someone confused, your first and foremost job is to pacify them. Okay, to make them safe, offer them a seat, pacify them, make them a little less anxious, and then confirm their details and then find out what they want. Okay, now coming back to that, this lady, she tells you, I want my daughter, I want my daughter. So ask her, okay, can you tell me some details about yourself? Okay, yes, like what do you want to know? I want to know your age. Are you 75? Yes, I'm 75 years old. And could you tell me something about your daughter? Next question. Yes, doctor, my daughter, her name is Meela. I want my daughter. I just want her, I want her to be here. So what will you say in this scenario? You will tell her, right, please tell her that, okay, we would contact Meela for you. Do you remember any details about Meela, like her phone number or her address? Okay, so she'll say, if she appears distracted, once again, just tell her who you are, where she is, and what do you want to do. Okay, so tell her that you are the junior doctor, you are in the emergency department, I'm here to ask you a few questions. Okay, I want to assess how you are, and I also want to know details about your daughter Meela. So move on. Next, after you have assessed these details, now this, right over here, the more you acknowledge her anxiety and keep introducing yourself, the more cooperative she will be with you. But if you are going to get nervous, if you are going to fumble, and you're going to tell her, and you're going to try to rush because the time is running out and you want to do your station, right, then this patient might pull you into a very difficult situation. So please don't do that. Okay, every time she appears distracted, try to pacify her and then ask her one question at a time. Okay, now when she asks for her daughter, you can say, yes, we will. Okay, if she doesn't remember any details of her daughter, please tell her that, okay, I'll look into your patient records and I'll try to find out contact details of your daughter, and definitely I would contact your daughter. But before that, I want to ask you a few questions regarding your general health. Is that okay? Please ask her general health. If you say, I will call her as soon as possible, she will expect you to go out of the cubicle and just call as soon as possible. So it's very important to tell your simulator that I am going to do this, but I want to ask you a few questions so I'm able to assess you. Okay, please make sure that you also make it known why you are here. If you say things like, I will call her as soon as possible, then you will be ending up in danger, in the sense that she will keep disturbing you throughout the station saying, call my daughter, you said you are going to call her as soon as possible, why are you here? Please go and call my daughter, I do not wish to talk to you. So don't put yourself in that situation. Okay, it can get tricky, and do not stick to the script entirely. You have to use and you have to negotiate through it. Okay, so best thing would be to keep acknowledging non-verbal cues, keep pacifying the patient, and then keep moving forward. Okay, now asking about her general health, please, here you want to know what is the cause of her confusion. You want to know whether it is because of an acute condition or it is because of a chronic condition, right? So this you have to rule out in the beginning itself, because the examiner will ask you doctor, why do you think this patient is confused? Please expect that question. If it says at the 6-minute bell, talk to the examiner, then it doesn't mean they want you to just say, yeah, my patient looks confused, I did the MMSE and the MMSE score is this much, so I'm just going to admit this patient, I'm going to do all the tests possible, I'm going to, call up the relatives. No, that's not what is even though that is a part of what is expected, but please don't think that you will pass if you have just said those things. Okay, you have to show them that I know how to negotiate, I know how to navigate through this question. Okay, so moving on, you need to find out what is the cause of her confusion, whether it is acute or it is chronic. Now, she may not give you time to ask a lot of questions, so what are the questions you will ask her? You have to decide that on the door itself, and please just ask 4 to 5 questions. If you ask a complete history, she will not answer everything. Okay, so the 5 most important questions I want to ask her would be: how are you feeling today? Do you have any fever, any flu-like symptoms? Do you have any other medical conditions? Do you have any allergies? You said you live with Mila. Anyone else who lives with you? That's all. These would be my top 5 questions. Okay, if I want to add another question, that would be: Mrs. Smith, which one of your hand do you use more often? Okay, I want to ask this question. Why? Because when I'm doing my MMC, right, I'll be saving a lot of time. That's why. So I can exactly tell my patient, if my patient is a right-hander, I can exactly tell them, this is a paper, please pick it up with your right hand, please fold it into halves with both your hands, please place it on the floor with your left hand. Okay, there's a component in MMSE where you have to use your non-dominant hand. So I want to save my time, and for that reason, before I begin assessing this patient for an MMSE, I want to ask whether they use their right hand or their left hand more often. Please remember, patients can be ambidextrous also, so I want to know which hand they are more comfortable using so that I know exactly what instructions I'm going to give. If you tell your confused patient which is your non-dominant hand while you're doing an MMSE, you will be wasting a lot of time. So please, my advice is ask in the beginning itself, which hand do you use more than often? Okay, now because we are discussing this scenario, I will give you the clues. So basically, the backstory of this patient is that she was feeling feverish the night before, and she wanted to get some medicine, but there were no medicines at home. She lives with her daughter Mila, and last night her daughter was gone out. She was not at home. So Mrs. Smith decided that she could take a small walk to the closest pharmacy and get the medicines. But what happened was she lost her way and she was confused. She didn't know how to find her way back home. So there was a park and she just ended up spending the night at the park. Okay, so this is the backstory. When will she tell you this backstory? Only if you have given her, you have pacified her, right? You have asked her the right questions. You have been good at negotiating what is going on. Please don't expect her to tell you this backstory in one go. She will not do that. If you keep asking her, pacifying her, and then asking her, okay, what happened last night? Do you remember what happened the day before? Or do you remember how you ended up in the park? If you ask her this way, then she will tell you. Otherwise, she will not tell you. Okay? So please remember that. I do agree that it's quite a lengthy scenario, but that's why I said my top questions, yes, would be differentiating between acute and chronic. So I want to know how her general health is, if she had any fever, flu-like symptoms, and if she has any other medical conditions that she is aware of, right? If she is on any medications, does she have any allergies? You said you live with Mila. Whom else do you live with? Anyone else who lives with you? Okay, my top 5 questions. And before starting MMSE, Mrs. Smith, I would like to ask you, which hand do you use more often? So she would say right or left. So you would already know what is the instruction you're going to give in MMSE. Okay. Now, if you think MMSE is quite lengthy for you to do and it takes a lot of time, so please start practicing right now itself. Okay. In fact, I always say that MMSE is something you should practice every day because it's very easy to forget. Okay. It's very easy to not think about it, right? So please remember that you should be doing MMSE every day. Okay, it's very easy. If you do it every day, you will find it very, very easy. Okay, now what I advise is always categorizing MMSE into 29 points and 9 points. Now, what are the components of 29 points? Okay, orientation of place is 5, orientation of time is 5, registration, spelling a 5-letter word forward and then asking the patient to spell it backward, counting backwards, subtracting 7, and recall of what you told her in registration. Okay, so all this is 21 points. Please don't worry if I'm going fast. I will send in the PDF for this so you can read it in that and you will understand what I'm trying to say. Okay, next, coming on to 9 points. So in 9 points I have 9 instructions to give her. Close your eyes, name 2 objects, repeat after me, no ifs, ands or buts. Please raise your whichever hand she doesn't use more than often, her non-dominant hand. Raise that hand, pick up the paper with the same hand, fold it with both the hands, place it in front of you. Now use the hand you use more than often, that is more often, sorry, your right hand. So use your right hand, write a meaningful sentence, copy these intersecting pentagons. See, it took me less than a minute to say the things which comprise of MMSE. So if you do MMSE every single day, you would know what are the components, because what happens is sometimes when we are not thorough with examination this way, we tend to sit back and think about, okay, what comes after orientation of place? Yeah, orientation of time. So you know, you're missing out on those 3 to 4 seconds just thinking, what is the next component in 21 points? What was the next component? So that's why my advice is, please, 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 every single day practice MMSE. Okay, I will send in the MMSE PDF. Please don't worry about that. Okay, about orientation of place, orientation of time, registration, spelling a 5-letter word, counting backwards, subtracting 7, and recall. Orientation of place, 5 points. Country, county, right, street, building, door number. So you will know 5 things in place. Time, what is the year, what is the season, what is the month, what is the date, and what is the day to day. So these are 5 things in time. Registration, you can tell them any 3 things, any 3 really simple things: coin, pen, apple. Okay, simple things. Please don't give complicated instructions for registration, just very simple things. Okay, coin, card, pen, or you can say pen, apple, coin, anything. Spell a 5-letter words, simple words, either smile or either world, any one of these 2. Ask the patient to spell it and then spell it backwards. Okay, count subtracting 7. A lot of patients may have difficulty doing this, especially elderly ones. Recall of the 3 objects that you told her. Okay, so this is in 21 points. All of this comprises 21, and the instructions that you give is for 9 points. Okay, is it necessary to ask, do you have reading, listening and writing problems? No, it is not necessary to ask, because your task is asking you to assess confusion, mini mental state examination, okay, along with some other scales which are used for examination of the mental status, are tests, right, or are score points which you use for confusion. And it's not a specific or sensitive test, and right now I would advise, please do what your task tells you. If you want to argue about which test is more specific, which test is more sensitive, then the PLAB 2 exam is not meant for those reasons. Okay, we can have this discussion after your exam, so as to which scoring system is more specific and sensitive, and which scoring system would bring about definitive answers for, you know, which keep in mind all of the reading, writing capabilities of a particular patient. If you try to read up MMSE introduction in one of the books that I had mentioned, McLeod's Clinical Examination, it already tells you over there that it's not a very accurate tool for diagnosing or for carrying out a mini mental state examination. However, it still works. This is what they say. Okay, it still works, and you are supposed to do it in the exam. So please don't get into the depth of asking if it's necessary, reading, writing and listening. I would rather you perform the task, know a little bit about the background, and have some points to say in the management. Please don't get into the depths of this, because if we do, then how else would they assess you if you know how to perform the scoring scales for confusion? So I will move into a little bit more depth. Okay, the most important thing is that you know what are the components in the MMSE. Okay, here your task says find out why this patient is confused and do the MMSE and tell your examiners. Basically this is your task. Please focus on the task. Next question, at what stage do we ask how did you end up in the park? It should all come in the history taking itself, not in the MMSE. Okay, when you're asking about fever or flu-like symptoms, you can include the question over there that do you remember what happened and why were you in the park? Okay, or you can ask in P3 also that you said you live with Mila, anyone else who lives with you, and how did you end up in the park? Is there something you want to talk? Is there something you want to say about that? Do you remember? Okay, so please either ask in P1 or ask in P3. Okay, so either P1 or P3 you can ask about the event which led her to being discovered in the park. Okay, now moving on. So you were performing your MMSE, but the 6th minute announcement came, and at the 6th minute bell the question says that you are supposed to talk to the examiner. Now please remember, if the question doesn't say at the 6th minute bell discuss management with examiner, what will you do? If your question says assess Mrs. Smith for confusion and discuss management, full stop, what will you do? You were taking the MMSE and the announcement came that it's the 6th minute. Anybody? What would you do? You are still doing the MMSE. Okay, your question doesn't say about discussing management with the examiner. What would you do? Yes, very good. Quickly finish the MMSE. Okay, please don't stop. Please don't stop. Over here the question says that at 6th minute bell discuss management with the examiner. So when it gives you instructions to stop, you will stop. When it says assess Mrs. Smith for confusion and discuss management, full stop, please don't stop at the 6th minute. Okay, examination scenarios, this holds good for all examination scenarios, not just performing an MMSE. If the question says stop at the 6th minute, you will stop. If the examiner tells you, right, if it's not mentioned in the question that you need to stop, but at the 6th minute bell the examiner says, okay doctor, you can stop and discuss with me how would you like to manage this patient, so at that time you will stop and you will discuss with the examiner. Okay, when the examiner doesn't say anything, okay, and the question also doesn't say anything, and the 6th minute announcement has come, please try to finish your examination and then start talking. Okay, and then start talking. So you can, until and unless you get any positive points in examination, do not stop. If you have got positive points in examination, you will stop. If you do not get any positive points, please do not stop. Continue with your examination. It doesn't matter even if you didn't say a word of management. It's okay. It's completely okay. Why? Because can you give management when you have no positive findings in examination? Question: can you give management when you have no positive points in examination? Yes, very good. Please remember this. I don't care who pressurizes you saying what, but if you do not get any positive findings in examination, please don't give management. In fact, you can continue with your examination until you come to a positive point and then stop and then say, ideally I would like to complete my examination, however when I examined you I found that this is going on with you and I want to do something about this. Okay, at that time you can say management. But if you do not have any positive points, if the question on the door says like this, let's take two examples like this. You are doing an MMSE and your score is 25. Okay, so she cooperated very well with you and your score has come up to 25. So at that time you know that okay, the MMSE is normal. Okay, so here you can stop and you can give management. Okay, over here you can safely say that okay, looks like the confusion is due to whatever you find in your history taking. Okay, it may be due to a medical condition, or it may be due to her fever, or any acute state causing the confusion. Okay, when you get a score of 25 and above, you can safely stop and talk about management. But if you're not sure about your score and it's coming less than 25, it's anywhere between mild, moderate or severe, at that time I would suggest, if the question doesn't say stop at the 6th minute, continue, try to finish MMSE, and then you can just say one line that I would like to complete the rest of my examination. Okay, look at the patient's observation and treat them accordingly, and you can move on. You will still score very good marks. But if you know already that okay, in this particular case this patient's score is 22, someone already told you, okay, someone who had the exam a day before you told you that yeah, the patient's score is 22, and then you go in the next day and you say my patient's score is 22 and I would like to manage them like this, you will get a 0. Okay, so please avoid putting yourself in situations like that. It's not necessary that a day before whatever scenario was there for that particular person is the same thing that you will have. Okay, please don't fool yourself like that it's not going to change. Oh, who cares about it? No, please don't fool yourself like that. Don't give anybody the opportunity to take away scores from you. Okay, if you assume, if you're firm in this belief that whatever my friend had a day before, I'm going to have it today, the same thing, then I'm sorry, you're designing yourself, you're setting up yourself for failure. I don't like saying this, but that's how it is. Please do not expect the same thing. In fact, if you are giving the exam on the same day and some candidate's score is 25 and your score is 15, right, it doesn't mean that both of you are going to fail. Maybe their task, when it was their task, the examiner instructed the simulator to give a score of 25. Okay, you will answer these questions perfectly, so your score should be 25. Before the other person entered, the examiner already told the simulator, see, you are not going to answer these questions. Okay, the candidate's score must come up to 15. So the simulator will say yes, okay, all right, I'll do that. So you can have anything on the same day itself. The score may change. That doesn't mean you sit down and you cry just because you think, oh yeah, I knew this person from my practice days, they were so good, they are definitely going to pass and I'm going to fail. Please don't do that to yourself. Don't put yourself in such pathetic situations. You are listening to me. I do not want you to put yourself in that. Always think that my exam went well, I have done everything honestly, whatever I knew, I will pass. You will pass. Okay, it's what you sow that you reap. Always remember that. You have time to practice, it's your duty to practice. There's no excuse for that. If you go to the exam thinking, yeah, when in March, when the exam was closed, was going to close, yeah, they had these scenarios, they will just start with the same things. No, you cannot do that to yourself and think that I have everything with me, I just give it one reading and go and I will be fine. You cannot do that. Please don't do that to yourself. Do some hard work. Even if you're doing MMSE every day, right, you're practicing MMSE every day, you are still benefiting yourself. Okay, even if it's a very small thing that you're doing, you are still working towards progress. Remember that. Okay, don't give any flow for negative thoughts to come in and capture your thoughts. Please don't do that to yourself. Okay, I know these things because it's very easy. It happened to me too, and it's a very big battle. Until you give the exam, it's very difficult. You have to go through all these issues, you have to overcome them, and then see your result that it's a pass. So there are many issues. I'm just talking about one of them. Okay, now moving on. let's talk about management. So you at the 6-minute bell, like our question says, so you stop. Okay, now let's discuss management of this particular scenario. See, in this case, it's very important first of all to know where this confusion is coming from, whether it's due to an acute cause or it is due to a chronic cause. Okay, first thing. Second thing, you don't know much about this patient. You just know her name is Mrs. Smith, and you know that she has a daughter whose name is Meela, and she wants her daughter to be by her side. Okay, so these are the only two things you know. So you also have to do a complete examination. She said she had a fever. She may or she may not tell you, but you also want to do a general physical exam, check her observations, do a general physical exam, review all of her systems, abdomen, cardiovascular, respiratory, right, and neurological examination. So you have to do all these things. So you have to say that, yes, first thing, I would like to finish my examination, that is check observations, do a general physical exam, review all the systems. Okay, next thing, I would like to do some tests like complete blood count, infection markers, ESR, CRP. I would like to send the blood and the urine for routine and blood and urine for culture. Also, I would like to do a urine routine test, check the patient's CBG, capillary blood glucose. Okay, and also I would like to take a heart tracing for this patient. Now, depending on what findings I may get on my examination, I would like to request for some more tests. So these are some things. Now, when you examine this patient and if you found out that she has some Krebs bilaterally, so of course you have to order a chest x-ray. That's what I mean. When you examine this patient, for example, and you found out that she has some tenderness in her abdomen, then you would have to order a ultrasound. So this is the reason why I'm saying that I want to tell my examiner that depending on what findings I get on examination, I will request for more lab tests. Okay, now next thing what I would do is I would look up for these patients' details, call their general practice, inform them, and get some contact details about the patient's relative. Contact the patient's relative and make sure that they come to visit their mother. Okay, this is the other thing. Now, doctor, what do you think is this confusion? What do you think? Why do you think this patient has this confusion? So you will say, from the information that I could get from my patient, what I found, my differentials for this confusion, it could either be due to an acute cause or it could be due to a chronic cause. When I tried to ask my patient, do you have any other medical conditions, they seem to tell me that they cannot recollect. So what I would do is complete my examination, wait for the lab reports, and then decide why this confusion is coming. So if your patient has not told you that she had a fever last night, then please say that I am thinking of a differentials, but I want to finish the examination and then tell you why I think this confusion may be a delirium or a dementia. Okay, if this patient has told you, yeah, I had a fever last night, so you can say over here that, yeah, most probably the confusion is secondary to an infection, okay, which may be viral, bacterial, or parasitic in nature. I will correlate my examination and lab results. Okay, please remember, when you are speaking to the examiner, you have to talk in medical terms. Please do not speak in simple terms like you speak to the patient. Don't do that. Okay, say whatever you say to your examiner, right? You have to use medical terms. You are going to be tested for this because there are many ways that a candidate is tested in the exam. Now, if you are very used to speaking in layman terms, and then when the examiner is asking you something and you say it in layman terms, you might be losing scores. So please don't do that. Every candidate is also assessed for how fast they can transition from layman to medical terms. So when you talk to your examiner, please make sure that you are speaking in medical terms. Okay, if you see that your patient is staring at you when you are talking to the examiner in medical terms, you can also tell your examiner that after I have finished speaking with you, I would like to talk to my patient and discuss with them what I think is going on with them. Okay, you can add in this point also. It looks very good. All right, now if the examiner tells you, okay doctor, I agree, to what you said, that this patient's confusion looks like it's secondary to a infection. So what will you do? Do you want to talk about sepsis 6? Please speak about the protocol of sepsis 6 if the examiner tells you this, if there are further questions. So be prepared in that regard. Okay, so either they can ask you more questions about sepsis 6, or they could ask you more questions about dementia. Now if you think that this confusion is due to dementia, what would you do? What would you discuss with the examiner? What sort of management would you discuss for dementia? You're going to involve a neurologist and get this patient assessed. Okay, why? Because you're going to be on high alert if this patient further suffers from a TIA or a stroke. Okay, so please remember the two directions in which you need to know what you're going to discuss with the examiner. Okay, so this is about this scenario. In general, examination stations, the most important point to remember in examination stations is, if you get positive findings at the 6th minute bell, you can stop and you can discuss your positive findings and how you will manage them. If you do not get any positive findings even at the 6th minute bell, continue with the rest of your examination, and when you have about half a minute left, you can just say management at that point based on the history that you have taken. If on the history this patient tells you, I couldn't see from one eye, then you have to say that I would like to continue my examination, and I would like to get my patient reviewed by a senior and get them evaluated by an eye specialist. Okay, so at that point you can say. Okay, so please remember that there are many things, there are many components that are taken into when a candidate is assessed, even for an examination station. Always remember to maintain a two-way conversation during an examination station. Now, if you have a real patient in the exam, maintain a two-way conversation. If you have just a mannequin, okay, there's just a mannequin kept in the exam, and you are supposed to teach the student or the medical nurse, there's just a mannequin, please don't talk to the mannequin. Okay, instead talk to the person who is in the cubicle. It may be the nurse or the medical student. Are you following me? Do you want me to repeat any of the examination points that I just told you? Okay, and then you can safely move on. Okay, the entire idea that at the 6th minute bell, whatever you're doing, you're supposed to stop and then say management, I do not believe in it. For me, what personally worked and what personally still works is that you do examination up to the positive point and then stop. Okay, so this is one thing that I want you all to know. And the other thing is, maintain two-way conversation. If there is a patient, always maintain two-way conversation during an examination station. If there is a mannequin, okay, no need to talk. If there is a student or a medical if there is a nurse or a medical student with you, maintain two-way conversation with them. Okay, and don't speak to the mannequin, that going towards the mannequin and taking permission, I'm going to do this for you, is it okay? The mannequin is not going to reply to you. Okay, so you have to tell that to your nurse or your student that right now I'm going to do an inspection of this area. So ideally, for if there is a patient, I will explain to them that I'm going to do this, and then I'm going to take permission and start. Okay, so if there is a mannequin and a student, verbalize it to the student or the nurse that this is how we would do it in a real life scenario. Okay, this is about examination. I think these are most of the points. We couldn't go scenario by scenario. There are quite a few examination stations. Okay, I would suggest please take a look, please read them, please try to perform them also. Even if you cannot access the mannequins, you can perform examination on, take permission from your relatives who stay with you, who live with you, and perform examinations on them. Okay, this is how you will practice If you are working, well and good, you must be well versed with examination already, should be a piece of cake for you. Okay, you're welcome. Right, so that's it. So we are towards the end now, and as I promised in the beginning, once the session is over, I'll post the link so you can listen to the audios, and about the recordings and the PowerPoint for these days, right, day 1 to day 5, I will post them through this week. Okay, so most of the points that I've said in the audio are there in the PowerPoint. It's not the same PowerPoint which I used for this, it's a different one, so you can have a look at it, listen to it if you want to. There are some points which I have said, even though it was like I think I took a very long time of yours. I'm really sorry about that, but thank you so much for attending the session. Thank you so much for appreciating my work. I really I'm really thankful to all of you for that. Okay, and then next week I will announce the session and the topic. Okay, we will continue as usual. All right, so that's it for today. Thank you so much.